All right, we will get going while folks are just joining here. Welcome to this morning's webinar on designing better, how to navigate complex problems using human-centered design. My name is Brock Hart. I'm one of the co-founders of Overlap, and I'm looking forward to sharing this today with all of you joining us. Overlap is a boutique design consultancy, and a lot of our work in the design thinking space has really been informed by our work with vulnerable populations, doing work around social impact, and really working on complex problems. And I think design thinking has its origins in product design. And when you're designing a product, some of the concepts around prototyping and testing ideas is a little more intuitive. It can be a bit trickier when you're designing services or experiences, or if some of you joining us today are trying to create system changes. And so we think we've learned quite a bit about this, and we're always happy to share that with folks. So what we're going to cover today, we're going to talk about why human-centered design and what we think is really important about it. We're going to spend a bunch of time getting into the process and how that process works. I'm going to share one case study from the Canadian Mental Health Association and a piece of work we did there that not only impacted the lives of people directly in that system, but created broader system changes. So we'll talk about that. And we'll finish with some resources that you can use to get started. And we'll do a quick poll just to get a sense of where folks are at. So how many of you know about human-centered design or design thinking? All right, so we've got a real mix here of folks that are familiar, people that know a little bit, and one of you out there, this is brand new, so enjoy as we work through this. All right. Oh, here, I can share the results. There we go. All right. So when we think about design thinking, this statement really comes to light for us, and this story is one of our stories about why working this way matters so much. I Need to Feel Dignity While I Die came from work we were doing in a hospital back in 2012, and we had a pretty broad brief. It was how might we improve the patient experience at that hospital. And this was part of a strategic planning initiative that folks were doing. And so when we do this work, we go and we chat with all kinds of people to try to really understand the problem from their perspective. And this sentiment came forward in a very powerful way. And it means something different today with things like right to die legislation, but at the time, it was people surfacing a desire to have a less scary death, to feel more human while they die. And dying is a really normal thing that happens in hospitals, but it's a thing we don't talk about a lot. And it's been interesting doing lots of work in healthcare over the years. I think healthcare is absolutely drowning in data, and it is so thirsty for human insight. And so when we do this work, because it tends to be qualitative in nature, these are the types of things that emerge. What came out of this insight from the work was a no one dies alone policy, where anyone from the administration to the staff were empowered to sit with someone and hold their hand and be with them to help them die better. And I think this is what this work can look like when it's at its absolute best. A deeply human response and solution to a uniquely human problem of being aware of your own death. And you know, again, in these healthcare spaces, we measure so many things. And I think in many organizations, we measure lots of stuff. But are we measuring the right things? We never ask people in hospital to measure, you know, rank out of 5, the extent to which they feel dignity, or how scared they were while they were receiving care. And we don't measure these things because we're not sure what to do with the answers. But I think this way of working and really involving people in finding solutions together is a big part of what makes this work, again, so powerful. Now, a much less heavy example, but same hospital, we were chatting with a guy in the emergency room, and it was the hottest day of the summer, and he had nicked his hand with a saw. He'd been building a deck. And so he'd been waiting for a while. You're going to wait a while for an injury like that, especially on a really busy day where there's lots of stuff going on. By the time we were chatting with him, he'd been waiting for a number of hours. And he said, you know, I'm grateful that I don't pay for this service directly. It's, you know, I appreciate the healthcare system, but I was working outside and I was sweating and I'm cold. I need a blanket. And but I don't know who to ask. And it took me a while to get this seat. And you can tell that it's really stressful in here today. Like there's a vibe in here. And I don't want to be a bother, but I'm cold and I need a blanket. And again, I think there was something in that story around, are we solving the right problem? What if we can't make the wait time shorter? What if the only thing we can do is make it better? Are we bothering to find out what that could look like? And so in both of these examples, it was better understanding what the actual problem was to find different types of solutions, and involving people that are experiencing those problems in helping us understand the problem space better and helping us co-create solutions together. And so working this way creates better outcomes. And it isn't about you having an answer, it's about you being willing to explore spaces together. And so this is why for us, we think this is such a powerful way to work and to work with people and work with communities. Now, the process itself of design thinking or human-centered design, we draw it like this. It's made up of 5 sets of activities, and we draw it as a circle because we really want to reinforce the idea that this process isn't linear. It is a set of activities that you can bounce around in, and it means you always have a way to take the next step. You always have the next thing you can do, because when we work on problems like this, they tend to be complex. And complex problems are really messy. We don't have a clear sense of the destination or where we're trying to get to. And we need ways to navigate them. We need ways to be able to make our way through them and to find a path that gets us to a destination. So what I would encourage folks to do is write this down. Write down, define, research, ideate, prototype, and test. When we think about how much time we're going to allocate to each of these 5 sets of activities, we kind of break it down like this. 15% of our time spent on define. I'm going to go through each of the 5 sets of activities in more detail in a minute, but 15% of our effort spent there. 20% of our effort spent on design research activities. 10% of our time on ideation or coming up with ideas in response to problems. 30% of our time on prototyping, and 25% of our time on testing. And by using a percentage model like that, it lets you think about how to scale a project or a piece of work. So if I only had a week to spend on something, that's how I would break down my time. If I had a month to spend on something, that's how I would break down my time. I would try to make sure I'm not spending too much time in the ideation phase, because coming up with ideas isn't the hard part. I want to make sure I'm testing those ideas. I want to make sure I'm building those ideas and prototyping them so I can test further, that I'm making space and moving, again, through that problem to find solutions that really work. So I'll just say that again for folks that missed it. Define 15%, research 20%, ideation 10%, prototyping 30%, testing 25%. And this is our process map poster. We're going to send this to you after in an email, so you can get a PDF of this. It gives you a way to, questions to ask yourself to kind of, again, bounce around. This is the messier version of what I just showed you in the circle. And we always, we start with some sort of describing the problem as we currently understand it. We know we've got a problem or we've got a challenge we want to solve. If we can clearly define that problem, great, we can move into research. If we're not sure if we can clearly describe that problem, that's okay. There are different questions and exercises we can do to try to figure out what that starting point is. When we move into our research, it's about doing our homework. It's about going and doing primarily qualitative work with people that experience the problem. Identifying stakeholders and making sure we're taking an inclusive approach to bring in as many voices as possible, especially when we're doing work that impacts the broader public or communities. Who's showing up? How are we getting to people and involving people that wouldn't normally participate? These are some of the things that we want to ask ourselves to make sure that we're getting a diversity of voices. Then from there, now we're going to start bouncing around. Maybe we're coming up with some ideas. Maybe we're going to start doing some prototyping if we've already got an idea that we want to test with groups. So again, we bounce around in this process. And we're going to send this poster to you after, but I'm going to take you through what some of these steps actually look like. So how might we get started? Define. There's a few things that we're asking ourselves here, and it's really about getting started, and we don't have to go really deep at this point. Sometimes just a question is enough. So how might we improve the patient experience at a hospital? That's a great starting point. We know that that's the subject is the patient experience, which means we know we want to go talk to patients and family members and frontline workers. Who are the people that are close to that problem? When we ask ourselves these kinds of questions, we like to create invitational beginnings or openers. So how might we is a nice invitational beginning, or wouldn't it be nice if is a nice invitational beginning. We do that because it invites us in. It doesn't presuppose there's a solution, and it's a nice way to get started because it's posing a question to be answered. I think very often we end up beginning with the group where they've got an idea that they really want to make happen, but we weren't really clear on what problem we were solving with it, and we weren't sure for whom we were trying to solve that problem. So again, asking those questions when we start is a really great way to frame a design thinking project. And one of the things, I mentioned complexity already, but just to kind of drill this home again, this way of working is really well tuned to complex problems, problems that really are sticky or defy being solved. And Brenda Zimmerman is a Canadian academic. I believe she's at York University. And she was part of Social Innovation Generation here in Canada. And she had a really nice frame for thinking about easy, complicated, and complex problems, which I think is really useful. Easy problems are things like baking. So if we want to bake a cake or bread, as we're all doing right now, there are steps, there is a recipe, there are measurements, you follow them. And if you do all of that, you end up with your baked good. Complicated problems are things like getting to space. So we as a species know how to get rockets into space. There are a lot of steps and checklists that you have to follow. You need a whole bunch of people with a lot of education and years of experience. But if it all goes well, we are able to successfully get a rocket into space. But it takes a lot. It's really complicated. Complex problems, she says, are things like raising kids. So I have 2 daughters, and the same input does not get me the same output. What works for one kid does not necessarily work for the other kid, even though they're both born of the same parents, they're in the same conditions. They react differently because they're human beings. And this idea of the input, same input doesn't get the same output, is a really useful way of thinking about complexity. And so in the same way that we engage with our kids to try to understand their needs, how they are responding to whatever the input happens to be, engaging with them where they're at is really what many of these problems require, and it's what this process really helps you do. So when we're beginning these processes, that define phase, it's really about beginning to get a sense of how complex is this, how fuzzy is this process going to be. And we revisit the define activities as we go. So once we go and start doing some of our research, we learn more. And we generate ideas and we test them and we learn more about the problem. And one of the things we often do in this work is go back and redefine that problem, or maybe get more specific about what the problem is. Those examples I gave before about wait times in an emergency room, if we fixate on the wait time and we think that's the problem, we're missing all of the other possibilities in there. So it's really about being open and taking a mindset that is about learning and being curious and having an openness to be wrong and to move in a different direction. I'll tell one quick story about that, again, just to bring that to life. We were working with a hydro company that was they needed to adjust the power lines in a neighborhood. And people in that neighborhood were really, really mad about it. And they were doing town halls and they had to call the police at one point. Like, it got fraught. And so anyway, so we got brought in to help them with this. And again, who's experiencing the problem? The people in the neighborhood. So let's go chat with folks. One of the things that emerged out of that was people were really concerned about their trees in the neighborhood. And from the hydro company's point of view, we have to trim the trees. People don't like power outages. If the branches get tangled in the lines, then you've got more blackouts. And so they're trying to maintain power for folks. But people cared about the trees a lot. And what we ended up realizing was that every single decision that the hydro company was trying to make about upgrading this power grid, if it was framed through the impact to the trees, then people in the neighborhood were able to really respond to that well and engage in that conversation in a completely different way, because the hydro company was meeting the people in the neighborhood where they were at and realized that the problem wasn't about the amount of power or blackouts or any of that stuff. The problem was people didn't want the trees impacted. So again, being curious, being open to what is actually going on is so critical to this work. So then once we have our initial statement, or we're exploring the problem statement, we go talk to people. You talk to people that actually experience the problem. We go to where they are. And we use qualitative methods to do this kind of work. I think too often we go to experts to tell us about something affecting a group of people, instead of going to that group of people and engaging with them and doing work alongside them, which creates better and more diverse ideas and helps us actually understand what's going on. When we're doing design research, it's really about listening to learn instead of listening to justify your idea about what people need. And it's a thing that folks really struggle with, because we get so attached to our ideas and we are sure that we've got the exact right one, and that if we just did this thing, it's going to make all of the difference in the world. So when we go and we do design research, when we go and we talk to people, it is really about taking a learner's mindset and listening to understand more and to understand better. And one of the things that is talked about in sort of the design community at times is this idea of falling in love with the problem. And I think that gets thrown around without really getting into what that means, but love everything about the problem. want to spend time in the problem space, I will often interact with groups that say, why are we spending all this time talking about problems? We got to talk about solutions. Well, if we love the problem, if we're interested in the problem, if we're interested in everything about it, if we want to critically understand what's actually going on, then we're willing to spend time there. And I think that that is a better use of our effort at times than coming up with ideas that may or may not solve that problem. So, you know, lots of situations where, depending on the context that you're coming to this work from, you know, it can be challenging to interact with certain populations or communities because folks can't come to workshops or sessions. We're all in a moment right now where we're working from home, and so we're not doing any in-person, face-to-face work. And so there's always challenges in getting access to people and making sure that we are appropriately rewarding their contributions or compensating them for their contributions. But one of the examples that I think really brings this again to life is work we were doing with UNICEF Canada around designing a children's index for Canadian well-being, and really looking at, from a child's perspective, what does well-being mean to them? We measure all kinds of stuff about kids, but it is not necessarily stuff that kids think are important about childhood. It's stuff that adults think are important about childhood. So as we're designing this, the index, we were doing engagement all across the country. We had experts and adults and kids and youth involved. And one of the exercises was ranking indicators. So there was a huge list of indicators, over 100, and we asked people to force rank them. So most important to least important. What was so interesting about that was children all across the country predominantly put at the very top of that list having or caring for a pet, having access to an animal in some way. The experts, almost to a T, listed that as the last thing, or sent us angry emails about how, if this was the type of stuff that was going to be included in this index, this whole initiative was for naught. And I think that example is such again, a powerful one of, are we listening to learn, or are we listening to be right? Kids are telling us what well-being is to them. So how do we take that and turn that into something useful and helps us move forward in the work? So once we've done some research and we've pulled out some need statements and we've found some insights and some things that we think are helping us understand the problem better, we create ideas and possibilities. This is the ideation phase. This is 10% of the time. It's really, we're very good at coming up with ideas. Ideas are easy, especially if you've got really good inputs like great qualitative research and an understanding of the problem, or at least the beginnings of that. It's easy to start generating ideas. And generating ideas for testing means that we're going to learn more about the problem, or we're going to learn more about possible solutions. So when we're doing ideation, this is really about quantity over quality. We're not trying to come up with the one killer idea. We're trying to come up with a whole bunch of ideas that, if we shared them, they would get us more information about better solutions, or perhaps it's a better understanding of the problem. There's lots of situations where, you know, we'll present an idea that is not actually addressing a problem, but people didn't have a way to articulate that until they saw something that was trying to solve it. So we think about ideas sometimes as probes into the solution space, or probes back into the problem space, that are going to tell us more about each of those areas. One of a dear friend and an overlapper, Dr. Linda Carson, talks about how to catch a big fish. And the way to catch a big fish is to catch a whole bunch of fish and throw back the little ones. The quantity over quality. If we take care of quantity, quality takes care of itself. And so it is one of the most challenging things for groups to do. And what I would encourage you to do is really push yourself when you're coming up with ideas, to not stop at the first idea or the first 3 ideas. Push yourself to create a list of 10 ideas. Or if you're in a group, one of the things we talk about is starting solo with our idea generation so that we're not priming each other. And so, you know, if we're starting an ideation session or a meeting, take the first 3 minutes and have everyone write down, you know, 5 ideas or 10 ideas. And if everyone writes their ideas down and then shares them, you're going to have more ideas quickly. You're going to have a greater diversity of ideas because we didn't prime each other. And it's a really lovely way of inviting external people into the process. When you start working that way, when we don't present first and then ask for ideas, but get people to write down their thoughts and then start having the conversation. There's a great equalizer in that. And when we can bring in external people, we love doing ideation sessions with the people that are, again, affected by the problem if it's appropriate to involve them, because they come up with all kinds of cool ideas, which aren't about being right or wrong. It's about them being different. It's about them having a different perspective. So they generate ideas that are really different. And we might learn something as a result of that. And often do. And the last thing to really reinforce is your first idea is often terrible. It's just not the right one. And that's okay. But perfect is your enemy. Trying to get it right. And then trying to justify why that is the idea. Be willing to throw your ideas away. Be willing to just let them go or let other people change them or add to them. The idea really isn't the hard part in this work. And when we start seeing ideas as part of that understanding and that learning and that listening, we're using ideas in a more useful way for solving, again, complex, messy problems. Because we want to build stuff. We want to prototype ideas because we want to bring them to life so that we can learn more. We can test ideas, but it's better to test an actual physical thing, or to test, you know, a potential communication that someone might see, or the wireframe of an app or a website before we go and build it, because we get different kinds of information from people. Often this is the piece that groups are the least comfortable with. And it's because many of us don't have making skills. And we don't see that as legitimate work. And so it's a challenging thing sometimes to get groups to try stuff and prototype stuff. And it's easier to think about a prototype in a physical sense. So the picture here of Wellbot, the beginnings of Wellbot, you know, it's an idea that came out of a design workshop that we were doing. You can see in the picture, there's an iPad precariously stuck in a piece of cardboard. And it was the beginnings of a rough prototype. If I said a robot that talked to kids about their well-being, all of you would imagine something different. If I sit this in front of you and say a robot that's going to interact with kids about their well-being, and there's an interface that you can click through, you're going to click through the interface and you're going to worry less about the robot part of it, focus more on the interface part of it, which is the thing I wanted to test. So when we're prototyping, we're thinking about what is the part of this idea that I want feedback on, that I want to test with people. And that's the thing I'm going to build so that I can get that feedback. So we don't have to prototype everything about an idea. We prototype the parts that we really want to test. And I think in many of our organizations, again, because the making skills aren't always there, it is helpful to look for people in your organization that do have those skills. So depending on the organization, maybe you have a marketing department that has graphic designers that don't typically get pulled into initiatives where we are trying to improve patient experience at a hospital, as an example. But maybe we want to pull them into a team to help us make things, bring things to life in a different way because they have some of those skills. So again, I always encourage folks to look around their organizations, and maybe you're finding people that are not traditionally who get pulled in, but might actually have some skills that are really useful. I think the other thing with prototyping that once we get people over the hurdle of, okay, we're going to make something or we're going to try something, that you got to try more than one. If we only prototype one thing, then we're falling victim to the exact same issue that I was talking about before, about only coming up with one idea. And then letting that be the idea that I'm gonna come hell or high water, this is the one. There were 5 other wellbots in a physical form that had different ways that we were exploring the interaction. Through testing, further prototyping and iteration, Wellbot eventually became not a physical robot, but became a chatbot that now interacts with thousands of kids all across the country around a variety of issues connected to their well-being or current affairs. And so we were testing more than one so that we could learn more and more about it. And you get more and more focused as you go, but it's through that interaction and it's through multiple versions of it that we learn more about the stuff that matters most in that solution. And because we want to prototype multiple versions of something, you want to keep it cheap and cheerful to begin. So again, iPad, super simple app interface that takes no programming to do, stuck in a piece of cardboard, is as inexpensive as you can get. Building a full robot that we're going to deploy as a pilot is a waste of resources if we don't know if that's even right. So again, we prototype so that we don't spend a bunch of money on an idea before we know it's the right idea. When we're doing this with services, you got to find different ways that you can do that. In one of our projects, we were looking again at the experience of people waiting at a particular center. And one of the things, people had sort of initial ideas that, maybe it'd be nice to have a couch or it'd be in a waiting room, or maybe it'd be nice we could get a fish tank and that would give people something to look at. And one of the things they realized was the chairs in this waiting room, they had a mechanism that would allow them to be hooked together. And because it had that mechanism, they were all hooked together. And what that meant for individuals coming in, and this was a situation where, again, it was a highly vulnerable population that might be uncomfortable with even being there, and certainly may be uncomfortable sitting next to someone. There was no way to move the chairs easily because they were all attached. And so it made people leave because they couldn't wait comfortably. And the other thing that sort of emerged was this recognition that for many of these individuals that maybe didn't have a phone or didn't have a watch, there were no clocks anywhere. And so people had no sense of the passage of time. They had no sense of how long they've been waiting or not. And so what we were able to do was prototype different ways for that waiting room and that whole service to be delivered, which helped us understand the clocks piece of it, helped us figure out that there were different ways to organize the furniture that was more comfortable for people, and promoted them actually waiting longer. And in ideation and prototyping, we're doing all of those things so that we can test, so that we can ask for feedback. So we're not continuing to do our research asking people what's wrong. We're coming up with ideas and asking them what's wrong with those ideas. Break the idea. We prototype to break things. We prototype to try and to get feedback that helps us understand how to make an idea better and actually work for people, to make sure it's going to actually solve the problem. So we ask to iterate. And so again, that idea of there were 5 physical wellbots that all eventually turned into a chatbot is exactly what I mean by iteration. Get the feedback, change the idea, and then get some more feedback. So you're constantly refining as you go. One of the things that we talk about in this work is you can ask just 5 people to start. So it's scary to make a thing and go show someone and ask them for feedback. And so, you know, you don't have to go out to 100 people, just go to 5 to get started. Take that feedback, change the idea, and go find 5 more. You know, multiple iterations is better than just one big blowout iteration. So as much as you can, I wouldn't spend all of my time making one set of prototypes and doing one set of testing. The ideal situation is to make some quick prototypes, do some testing, change them, do some more testing, and keep moving down for as long as you're able to within the scope of your project, whether that's your time or the budget. Give yourself more time in these spaces. That's why we put so much emphasis in the process on prototyping and testing, because that's really where a lot of the magic comes out. The last thing about testing and asking for feedback is the way to do it. We're really bad at giving feedback, and it's because we haven't been taught how to do it very well, and too often we think it's about providing you know, constructive criticism that often is just, you know, can be mean or is not helpful. So again, something to write down is the way to do feedback properly. Ask people what they like about the idea. If we don't ask them what we like, we might have missed something really, really important about something that we put forward that we could get rid of if we only focus on what people don't like. Ask people how to improve on the idea, on the prototype. Ask people to what questions they have about the idea, which is a nice strengths-based way of getting feedback because it begs an answer. So when I ask you a question about, well, why is the waiting room set up this way? Or why aren't there any clocks in here? That tells me something about what someone is looking for that, again, maybe they hadn't articulated before or didn't have a way to before, and gives me an idea for how to iterate and add something to my solution. And the last thing when we're doing feedback is to ask people what else it reminds you of or makes you think about. We all consume so much content. And when I'm putting forward ideas, I want you to tell me about the TED Talk you watched on an octopus that does this, that, and the other thing. If for some reason that's what comes up for you, I might go watch that TED Talk to see if that helps me with some of my iteration. So ask people to make connections for you. So all of this coming together in one project, Dignity by Default was a piece of work we did a number of years ago in the mental health and addiction space. And the brief was pretty, again, broad. How might we improve the experience of patients in this system? One of the things that we really liked about this initiative was the recognition that for people receiving service in this space, their lives are obviously so much more than just their healthcare experience. And so the Canadian Mental Health Association wanted us to not just engage with people about healthcare, but to get a much fuller picture of what their lives are like, so that then the health services could say, well, maybe there's a different kind of role we could be playing for people. So with that brief, we went out and we chatted with patients and families and frontline workers. Again, being a more vulnerable population, that is often street involved, that again, a group of folks that do not want to come to our studio to a workshop, we went to where people were. And this had us doing engagement with people on the street, at a soup kitchen. We went to drug court. We went into a park at night. We went to people's homes. We went to where people were. And we engaged with them in spaces that were comfortable for them so that we could really understand what their experiences were, but also to create spaces that were safe and dignified and allowed us to do this work together. And we then went through a process of co-creating a service standard called Dignity by Default. With, at its core, it was about creating a more human set of experiences for people. That I get help for my healthcare issue is table stakes. That I'm treated like a human being while it's happening was a thing that people were really asking for. And there were a number of things that were creating an experience for people that didn't feel as human as they wanted. And so this service standard was a set of principles that could be applied to a healthcare service within an organization to allow it to be redesigned with these principles in mind. And it was absolutely transformative for the organizations that implemented it. Ultimately, that whole system took on the concepts from Dignity by Default, and it changed the service experiences that folks were having. But it also included a lot of implementation around moving resources and getting the system structured to support delivering on this. So it was pretty cool. But more to the point, the library looked at this and said, well, wait a second, we also serve this population. And what are the ways that we could actually bring Dignity by Default into our organization? And what might we change about the way that we do our work? And the police looked at it and said, well, this is really interesting. What does it look like for us to have a value around welcoming? And what if we were welcoming people into our service instead of creating an adversarial relationship right off the bat? And so it caused a number of different conversations, which was not the original brief, but people were able to come around this idea that they were all serving the same population, creating really different experiences for them. And it began to facilitate a different set of conversations about creating good outcomes for people and with people, and how to do that better. So this approach has had a profound effect on our understanding of those we serve and on our organizational culture. Design places the highest value on the needs and insights of the end user. This uncompromising focus on the person receiving service fuels the passion that staff and decision makers have for making a difference in the lives of people. So Fred Wagner is the former executive director of the organization, and the one that really spearheaded this work and was really leading that system transformation. There were a number of folks that were with him and really driving that work. And I think one of the things that is sometimes a surprising outcome of working this way is recognizing that the journey of the work is sometimes the outcome of the work. You don't always get to a system changing solution that really radically changes the way that something is delivered. Sometimes what happens is you change as an individual because you're engaging with people in a different way. They have a different relationship with your organization as a result of engaging with you in a different way. And so sometimes it's just the beginning of bigger change. And I think that Fred really summed that up really beautifully for us when he said, what he's been hearing from his team is that for some of them, they have been reintroduced to the person they were when they got into healthcare to begin with. And I think that is because they were reconnecting with patients and their needs and their lives in a different kind of way. And I think that's a really beautiful sentiment. So again, these projects are messy. We talk about them in a linear step that we went from here to there to here, and it all was very clean. You get into this work and you get stuck. You bump into a wall. You thought you had a good path, and you realized that your ideas, none of them work, and you're not sure where to go next. So this poster is a simplified version, but it gives you a sense of where to go next. If none of my ideas are the right ideas, I got to go back and talk to more people, or I got to come up with new ideas in response. Maybe we need to bring more voices around or perspectives around our ideas to generate new and different ones that we can't come up with on our own. If I'm not sure how to build something that feels like the right thing, how can I get the right skill set to help me in that? So again, these are often messy projects. And what's the next thing I can do is, I think, the most important thing. Take the next step toward a solution. And that's what this poster, which again, we'll send you the PDF, is meant to help you with a little bit. We'll also be sending this out in an email. So there's a number of recommended resources from us that will be helpful. We have a blog post, 75 human-centered design tools and resources explained, whole bunch of stuff in there that folks really like. We'll send you how to use an empathy map. An empathy map is a really useful design research tool that gives you a way to do an interview to get a better understanding of someone's experience by asking the questions in that empathy map. And once you're creating empathy maps, you are beginning to create a more vivid picture of the types of people involved in whatever your project happens to be. Another post of ours, how to improve a project in 10 minutes by asking 4 simple questions, is again a really helpful way to engage in some of that define phase of a project. So we'll include that one. Designingbetter.ca is the project website for the mental health case study I just gave you. What's nice about that website is you will see, we captured the whole process. So you'll see what a design workshop looked like. You can see the service standard, some of the pieces that went into creating it. So it's a really nice reference and it's a great resource. We'll send you the process map and we'll send you a link to Overlap Gear, which has things like our process cards and our design thinking deck, which have helpful nudges, prompts, and instructionals for how to do some of this work. And in our final 9 minutes here, we'll open this up for some questions.
So folks, you can use the Q&A box on the side or the chat to submit questions, either work for us. One question here is, Brock, you mentioned a few tools. Your favorite go-to tool for new designers? What's the one tool that folks should start using right away?
So the empathy map, which again, we'll send you a link to one and you can download one and print it. Empathy map is huge, and it is always transformational for folks because they just haven't thought about some of these questions before. So what you'll see in the empathy map tool is a little picture of a face, and some of the questions we ask in an empathy map is what someone is thinking about as they're having a particular experience. So what am I thinking about? What are things I actually see while this is happening? What do I find myself saying? How do I feel during, again, whatever the experience is? What am I actually doing? And what are things I hear? That gives you a really fulsome sense of what someone is experiencing. And again, we can't expect that people can tell us exactly what they need because people don't always know, but we can infer from that things that people are trying to accomplish or parts of an experience that need to be improved by getting a more sort of sensory view of them. So you can use it as a research tool, but you can also, it's not necessarily as good as getting it informed by an actual person, but even sitting down and saying, I'm trying to imagine my customer or my client or my stakeholder, what do I think they're thinking? Sometimes that's a really interesting exercise to begin, and then contrast that with what you actually learned from your research. How right were you or wrong were you? You're wrong in many instances, but your perception of what you think people are experiencing is also a useful thing to include. So empathy map is absolutely one of our favorite tools. All right. So thanks so much for coming. Also, we'll just plug a course we're doing. We've got an upcoming course, Human-Centered Design Launch. So this is an introduction to design thinking and creativity. We used to do our trainings as in-person sessions. We do them all virtually now. And so this was formerly a one-day in-person course. Currently, we're running it as 3 90-minute sessions. It's happening June 11th, 16th, and 18th. And we'll send the registration information and a 10% discount code for all of you that participated today. Thanks so much for joining us. And my email address is right there. If you have any questions, I am happy to answer them. Part of our mission is getting people to work this way because we think it creates way better outcomes for people. So always happy to answer questions and have further conversations and dialogue. Thanks so much, folks. Have a great rest of your day.